Welcome to my 50K sub special. 50,000 subscribers. That is so cool. Thank you so much to each and every one of you. I had no idea it was going to grow this big. I started it off as a way to give my clients some homework or self-care routines and techniques that they could do in between their massage sessions to extend the benefits. I never knew it would grow this way, and I would be hearing from people all over the world. So thank you. That is awesome. And today I wanted to do something a little different for you. I want to answer your questions. So I pulled a bunch of questions off of the comment sections of my videos, and we're going to answer them on video today. So the first one is it normal the head is not equal on each side? Each side seems different. Yes, it is completely normal to be different on each side. None of us are really perfectly symmetrical. It is very, very common. You're going to feel tightness or tenderness or pain on one side when you're doing self-massage. When you're stretching, you might feel like you're more flexible on one side and another side is more restricted. That is completely normal. In fact, I would call it unusual if I worked with somebody who was completely symmetrical on both sides. So yes, that is absolutely normal. Second question, I have a bit of a winged scapula, weak rhomboids. I'm not sure if shoulder stretches, back stretches, or chest is the best. Which one helps with winging? Well, winging usually means that your serratus anterior muscle is a bit weak. So that's a muscle that wraps around the ribs, but it goes in between the scapula, shoulder blades, and the rib cage and holds it on. So if it's weak, it could let the shoulder blades sort of come off a little bit off of the rib cage. Also, your pectoralis minors can be tight, pulling in the front and sort of pulling the scapular shoulder blades around towards the front, also giving them that winged appearance. What you want to do is strengthen the serratus anterior. So really good for that is planks. If you hold a plank, a full arm or a forearm plank, do some push-ups, and you want to strengthen the upper back. So you want to do extensions and lat pull down, squeeze the scapula together and get that all toned and stronger. And you want to stretch the front, stretch the chest. So any nice things that open up, the doorway stretch, you can interlace your fingers behind you and open up. You can lie on a bolster or a pillow, extending the spine, lengthening through the front, strengthening in the back. That's what you want to do for winged scapula. Next question. Should I exhale through my nose or mouth, please? That is an excellent question and one that many people ask. You always want to inhale through the nose. Of course, unless you're sick and you can't breathe through the nose, then please breathe through your mouth because you need to breathe. But you want to inhale through the nose because it humidifies and filters and warms or cools the air depending on the temperature and what your body needs. It also gets the air down into the lower lungs. We get that oxygen in deep. We use our diaphragm. Really nice full breathing, and that's a very relaxed way to breathe. It lowers anxiety. When you breathe through the mouth, that usually is an indicator that your anxiety levels are up a bit. So you want to breathe in through the nose and also breathe out through the nose, generally speaking, because it constricts the air a little bit and you have control and you empty out the lungs more fully than you usually would with mouth breathing, where you'd probably take a new breath in before you've exhaled fully, and then you get that sensation like you can't take a deep breath because you already have that air reserve, and that could increase anxiety, or anxiety could cause that kind of breathing either way. So you want to exhale through the nose. An exception to that would be, say, if you're doing meditation or yoga and you're practicing some other breathing technique, you would breathe in through the nose and then out through pursed lips. So you still have that control and restriction. You're just making it about the mouth instead of the nose. So you would breathe in through the nose and then out through pursed lips to breathe out fully. Another exception is when you're exercising, your heart rate is up, you're going to want to breathe in and out through the mouth then, which sort of happens naturally because your body needs air fast. So that's a time when you need quantity over quality. So you get the air in and out as you're pumping your blood and you're going, right? But when we're relaxed, or just throughout the rest of our day, we want to have that quality over quantity. Okay? Next question. Can anxiety cause pain in some part of the body? Yes, anxiety can cause pain pretty much anywhere. Some real popular anxiety places are headaches, migraines, stomach aches, belly aches, low back pain, but really anxiety could cause pain pretty much anywhere. We're walking around tense all the time, so our muscles get tired. It switches off our rest and digest, and it switches on the fight or flight. So there are normal processes like digestion that are being ignored, and all of this can, yes, cause pain, and also pain can cause anxiety. So you get into a loop, because if you're in pain, of course, you're going to be anxious about it. And also, if you have chronic pain, say you have chronic low back pain, if your anxiety levels go up, chances are that those areas that are more sensitive, more vulnerable, are going to increase in pain as well. So yes, that's why it's so important to control our anxiety and try to get those levels down. One of the reasons it's so important. So the next question is, I'm training for a marathon, good for you, and can you tell me what type of massage I should be asking for? This is good. I've been asked that actually a lot of times, just people looking for, they have neck pain or shoulder pain, or somebody's going to run a marathon. And a lot of people think they need to ask for a specific type of massage, and I know that a lot of places have sort of menus of different massage modalities that you can ask for. The modality, that doesn't really matter so much. I mean, as far as I'm concerned, like sports massage, Swedish deep tissue, myofascial release, all of that can be very different from therapist to therapist. They overlap. They're interpreted differently. So what I would do is find somebody who specializes in what you need. So if you're going to run a marathon, you find somebody who specializes or has a lot of experience with runners, right? If you have neck pain, you find somebody who works with necks, who specializes in neck pain. So that's what I would do. I would find somebody who will meet my needs, right? What's wrong? Somebody who has helped a lot of people with my problem, that's who I want to go to, right? I don't care if they solve it with myofascial techniques or proprioceptive neuromuscular facilitation. I just want them to help me with my problem, right? So that's what I would suggest. I was in a car accident 3 years ago, sorry about that, and have not found relief for the constant pain until this self-massage. I think they're talking about the thoracic outlet syndrome massage. Is there a risk in massaging more than once a day? Excellent question. It depends on where you are. If you are, if you were still acute, and it's not that long after the car accident, I would be really careful. I would be really soft, and I would not do it more than once a day. But 3 years later, if you're finding that it is really helpful and you're not causing yourself any pain or irritating the nerve bundle, then sure, you can do it, try it twice in one day and see how you feel the next day. If you feel like that it aggravated it, back off and do the one. So really it's listen to your body, because everybody's at a different stage in the healing process, and everyone's body can take, some amount of massage and treatment before it gets to be a little too much. So you want to increase really slowly and try. Another thing you could do is just take a few of your favorite techniques from my massage and do them, a couple times throughout the day. You don't have to, set aside 15 minutes to do the whole massage all the time. You can just, that thing that really helps release it in the middle of your workday, just go ahead and do that one thing for 2 minutes and then go back to work. That's super helpful too. Next question. Is it normal to feel tender or sore after the massage? I'm not sure if I'm pressing too hard. So after you massage an area, it could feel activated. It could feel it's sort of just be talking, because, talking to your brain, because you haven't maybe paid much attention in the past and now you're very aware of it. But no pain. A little bit tender. Yeah, I guess if it's like really slight, it could feel a little tender. I wouldn't go more than that. If it's hurting more than that, yeah, you probably went too hard, too long, too much, and I'd back off. It shouldn't hurt at all during the massage. So that hopefully it won't hurt after. If you're having that experience, back off the pressure and maybe even shorten the massage. Just try 1 or 2 techniques, experiment, see how it feels. Does it get better? You can also see, since you already experienced some pain and tenderness after, what happened after that? Did it get worse? Did it get better? And, use that. If it got better after that, this might be a great self-massage for you. I would just back off until you're ready to take more pressure. Hi, Rachel. Hi. I seem to be having some issues related to bad posture from sitting all day. Don't we all? It seems my neck muscles are very sore and tight and are twitching in a way to my chin. Does this make sense, and is there a good fix? Yes, it makes sense. It makes complete sense. If you're all rounded forward, right, then your spine would be rounded forward, and in order to see your computer screen or anything, you have to look up. So now you're extending your neck and sticking your chin forward. That's going to all create a lot of tension. You can see in this whole area. So chin, yes. It puts a lot of strain on the sternocleidomastoid muscle, SCM, right over here. You can see it's pretty prominent on me. And the suboccipital muscles are getting compressed, and the cervical extensor muscles of the neck are going up like this. So yes, all of that will, create different sorts of symptoms. It could make headaches. It could create TMJD, right? A lot of poking out the jaw, and of course you can get symptoms in the chin throughout the jawline. So that's completely normal for that sort of posture. It's not desirable, right? So what you want to do is first look at the ergonomics of your workstation and see how you can improve, make it real optimal. You want to be sitting up straight. You need a lumbar support, right? And you want to sit all the way back in your chair against the lumbar support to keep the integrity of that lumbar curve. You want your shoulders to be relaxed and down. You want your elbows bent at 90 degrees. You want your wrists straight. You want the screen right in front of your eyes so you don't have to look up or down or side to side. For more specifics, I have several videos on posture, and I have one of computer ergonomics, just, sitting at a table with a laptop, how to make that work for you. And I do have some massages that can help to correct, and some exercises and stretches that can help to correct rounded posture like that. And once you improve, and your spine is more aligned, and your shoulders can rest on your rib cage, and your head can rest on your shoulders nice and squarely, those symptoms should probably decrease and possibly go away completely. Next question. This was in my okay, so this is 2. One was in my foot massage video. I'm not gonna lie, I had a hard time with this one. I can't sit crisscross due to a hip deformity. Any suggestions? And then a similar one with my shoulder massage. I wish my hands were stronger. Rheumatoid arthritis problems. Any tips? So there's always ways to do it. You could always modify and change things. You don't have to be able to sit cross-legged to do, even people without hip deformities, sometimes can't do that. It's a flexibility thing. So for the foot, I would take a tennis ball or a lacrosse ball and put pressure under the foot and just, step on it and just roll it under your foot. Find those nice tender points, find the points that feel like it's a nice release, really get into that medial arch. A tennis ball would be a little softer, a lacrosse ball will be a little bit firmer. So depending on how much pressure you can take and what feels comfortable, if you sit down and roll it under your feet, you can, it's easier to have less pressure. If you stand up, it's easier to put your body weight on and have more pressure. So that's a great way to do the feet. Now you can also use the tennis ball or lacrosse ball with your shoulder, or a massage ball. They sell specific massage balls, but you don't have to have one. You would put it between your shoulder and the wall, like right in a doorway, and just lean on the ball and kind of move from side to side and let the ball roll on here and massage out your pecs. So that's a good way. You can also use massage tools. So if you're able to hold a massage tool and do something there, but if that hurts too much, obviously don't use your hands, just roll on it. If you want more pressure, you can lie face down on the floor with the ball in your pectoral area and massage that way. But that's pretty intense, so be careful with that one. Biceps massage. Is this safe? It hurts, but feels good at the same time, LOL. Okay, so it's safe as long as you're listening to your body. If it's a little bit of tenderness, if it's, I mean, really mild, not even into the pain, just like a little discomfort while you're doing it, that's okay. And if it feels good, that's good. That's a nice relief. That's a good pain kind of thing, right? If it's ouch, back off. You don't want to be causing yourself pain. So in terms of, is it safe? Listen to your body. If your body is saying, ow, that hurts, it's too much, then no, it's probably not safe. So just start lighter, and then over time, if you practice the massage for a while, you'll be able to get deeper and it'll feel better and not be painful when you do that. Next question, face massage. Will they cause wrinkles? No. Massage does not cause wrinkles. Wrinkles develop over years and years and years and years and years of facial expressions and possibly sleeping with your face squished to a pillow, something like that. But no, not massage. Upper traps release. Okay, do you know, do you or anyone know why it happens that it feels so tight and it's so stressful? So for so many people, that upper trapezius muscle, those shoulders tend to creep up and are really tight. Stress and anxiety is a main cause of that. That can do it. And also that posture we were talking about, that bad posture. There's no like bad or good, but not optimal posture, rounding forward, right? And that can also put a lot of strain on that upper trapezius muscle. It's trying to hold you up so you don't fall down onto your desk, right? So those are the two, I would say, most common reasons for upper trap tightness are anxiety and stress or posture. But of course, there are so many different reasons that a muscle could get tight, right? Desk stretches. So I do a video of stretches that you could do right at your desk. And they said, should I be concerned that instead of feeling good, a lot of these stretches hurt? I'm only 22, but I'm usually pretty achy. You know what? Stretches don't always feel great for everyone. For some people, they're a huge relief, and some just don't like it. And usually it's people that aren't quite as flexible and feel like they have to push to make the stretch happen. But no, stretches should not hurt. So you want to try to go into them more slowly and only go to your end, right? You don't want to push past that barrier. Just go to where you feel a comfortable stretch, basically. If you want, you can check out I have a lazy stretches series. It's 3 videos showing lazy stretches, but what it is basically is just really easy, nice stretches for the body that you can enjoy, that can feel good, and that don't take strain or work. You just have gravity on your side, and it just feels nice. And they're very effective stretches, so you can check those out. This was on my tennis elbow one. Can I use a heating pad in conjunction with the self-massage? If you have actual tennis elbow epicondylitis, it's an inflammatory condition, so you don't want to put heat on inflammation. Inflammation is already red and hot and swollen, and heat will just make it more red and hot and swollen, right? If you want to do anything, you might ice it for a bit, and that could alleviate it. But over time, when it becomes chronic and muscles are just really tight from having, experienced pain for so long, then yeah, you can put heat on to relax tight muscles. As long as there's no inflammation and you're just trying to calm the area down, relax the area, that's a great time to use heat. Hi, Rachel. Is it possible that because of a tight jaw muscle, I felt pain in my head around the ear? Absolutely. You have a great big jaw muscle that goes right around the ear, sort of like a seashell, called the temporalis muscle. And yes, absolutely, you could feel that. So if you put your fingers there, your hands there, right around the ear, and you clench your teeth shut, take a bite, open and close, you're gonna feel that muscle pop in and out, right? So yes, that is very normal. Okay, on my carpal tunnel one, do you recommend doing these exercises in the same order, or can it be done in any order we choose? So there's no law about, which order. The way I show it is usually from the gentlest to kind of warm it up and then get, deeper or more intense. In that particular video, I did the self-massage first and then the nerve flossing, because the nerve flossing can be intense, and I wanted to make sure all the muscles were nice and relaxed before we went into the nerve flossing. But if you find that another order works better for you, go for it. You could take one or two techniques and do them throughout the day, however you like it. But the way I demonstrate it is usually the recommended, or what I would recommend. And anyone know why my shoulders are tensing from sitting in bed? Yes, your bed offers no support. So especially if you're going to be sitting there for an extended period, your pelvis will just collapse down sort of into a posterior rotation, and the whole back will be rounded, making the shoulders round forward, and again, the forward head extended neck thing. Or if you're reading or something, you're looking down and your spine is working super hard to hold you upright. So that would be why your shoulders are tensing, because all your muscles are working really hard against gravity with no support and no help. So sitting in bed or sitting on your bed for any length of time, not recommended. If you're going to be doing something, working, sit in a chair at a table, get your lumbar support, and work out your ergonomics. So those are all the questions I was going to answer today, but feel free to send me more. I'd be happy to see them. I am so excited that I now have over 50,000 subscribers. That's awesome. I hope you continue to watch and enjoy and get benefits from my channel. And I will see you in the next one. Thanks so much.